today we'll be talking about high blood pressure or hypertension as it is called, and how it affects your kidneys. Hypertension or high blood pressure is a common cause of chronic kidney disease. How does high blood pressure cause damage to the kidneys? And the analogy that I always use is, imagine that you have a pipe through which you are pumping water. If you pump water through it with a lot of force, what will happen to the inner lining of the pipe? The inner lining of the pipe gets damaged, and over time, if you continue pumping water through it with a lot of force, it will cause damage and it will eat away the pipe, and eventually it will cause the pipe to develop holes. Now, something similar happens when you have high blood pressure. The blood is being pumped through our blood vessels with a lot of force, and the small blood vessels which supply the critical organs in our body like the kidneys and the heart tend to get damaged. Now, initially you don't feel anything because the body tries to take care of it, but over time it does lead to permanent damage, and subsequently it does lead to especially within the kidneys, the very small blood vessels within the kidneys called the glomerular capillaries get damaged permanently and leads to scarring in those blood vessels in those areas. And this is how we start developing kidney injury and subsequently kidney disease. Now, if this goes unchecked over a long period of time, it will lead to chronic kidney disease. What are the normal blood pressures? And the normal blood pressure is anything below a systolic blood pressure of 140 and a diastolic blood pressure of less than 90. Anything above that is considered to be hypertension. Of course, if it's lower than 130, it is much better. Systolic blood pressure lower than 130 and diastolic blood pressure lower than 85 is much better. So for high blood pressure management, it involves both taking the medications or what we call pharmacological management, or through the non-pharmacological management. Now, pharmacological management involves taking medications for the blood pressure to bring it under control. The most important thing to remember is that we are not curing the blood pressure, we are just controlling it. So what the medications do is that they tend to bring down the blood pressure. So the minute that you stop them, after some time you notice that the blood pressure starts going up, because we are not cured you of the blood pressure or the hypertension. So it's very important to remember that. A lot of times when your blood pressure is high, even as high as 170 over 100 or 170 over 110 or even up to 180, a lot of patients don't have any symptoms. There's no headaches, no dizziness, no chest pain, and people wonder, why am I taking these medications if I don't have any symptoms? And the simple reason is because this high blood pressure will cause damage to your critical organs like your heart, the kidneys and the brain over a long period of time. So it is very important to remember that, and that is the reason why you are taking these medications without fail every single day. The answer is no. These drugs are helping to bring down your blood pressures and helping to protect your kidneys. Of course, they have to be taken under supervision. You have to go for regular checkups, especially if you have these chronic diseases like diabetes or high blood pressure. So it's very important to remember that. Okay? What are the non-pharmacological means of controlling your blood pressure? Now, exercise is extremely important. Brisk walking every day for half an hour for at least 5 days in a week is what is currently recommended by the American Heart Association. That is very integral when it comes to controlling the blood pressures. Reducing the amount of salt you are taking. Salt contains sodium, and sodium is very detrimental to our bodies because it increases our blood pressures. So it's very important to remember that you have to reduce the amount of salt. So the question is, how much salt is harmful and how much salt should I take? So what is recommended is that when you're cooking food, just add a pinch of salt in a very simplified way, and don't add table salt on cooked food. Okay? So whoever is cooking food at home should remember that they should just add a pinch of salt, and there should be no salt on the table. So that's a very simple advice that I give my patients, and this really helps them as well. Weight loss, another very important tool that we can use to control our blood pressures. And studies have shown that when you lose weight, your blood pressure starts coming down. Okay? And it's through exercise and diet. Okay? We should avoid eating junk foods. We should avoid eating the processed foods that are high in preservatives. All of those foods are not good for us. Okay? Eat a healthy, balanced diet, exercise regularly, eat more of the fruits and vegetables, and this will help you to lose weight. This will help you to control your blood pressures as well. What about somebody who already has chronic kidney disease? If somebody has established chronic kidney disease, then there are certain fruits that they will need to avoid. Things like bananas, avocados, we'll need to avoid those. Of course, we're going to talk about all this in much more detail in the later series, but just to mention that for somebody with established chronic kidney disease, then they need to avoid these kind of foods.